My name is Emmanuel Chukuma Onoha, member of Rotary Club of Kampala Muyenga Breeze, chartered member. My role in the Rotary Club at the moment is chair service project. At the moment that's for the year 2016 to 17. In neurosurgical medical camp, we handle ailments like hydrocephalus and spina bifida. We partner with Dr. Christie, a neurosurgeon specialist from Australia, who handles the operation side of it, that is the surgery part of the camp.
My name's John Christie. I come from Newcastle, Australia, where I work as a neurosurgeon. I've become involved here doing neurosurgery camps through the Rotary Club of Muyenga Breeze. We have relationships with local neurosurgeons, Dr. Joel Kiriabiri, who actually spent 2 years in Newcastle as part of his training. We also have a contact with Dr. Oscar Obiga, who was one of the Ugandan neurosurgery trainees who has been involved with the camp for I think the last 3 years. We've treated children with hydrocephalus and spina bifida. We've treated some children with tumours. We've treated adults with tumours. We've treated some adults with spinal conditions. I think we've also treated some adults with hemorrhages and aneurysms as part of previous camps. Hydrocephalus in children is a condition where the fluid that is within and around the brain can't circulate as it normally would, and the spaces that the fluid is contained in become larger and cause the head to enlarge, and that's probably the main feature that we see when looking at the babies who have hydrocephalus. If the condition is not treated, it can cause the head to progressively enlarge and also interfere with the development of the brain. Patients are screened and imaged before the camp starts. I think this is a very important part of the process, and I think this is potentially one area where we can improve the process so that we can have more patients screened prior to me arriving, perhaps have a slightly better idea of the number of patients that we're going to have that will require surgery for the camp.
After the screening, we send them for scanning. In the scanning is where we identify the patients who are really in need of the surgery.
There are a number of ways of treating hydrocephalus, and there are some operations that can be done to try and alleviate that, diverting the fluid in another direction or trying to bypass if there may be an obstruction to the way the fluid circulates. One of the other conditions we treat is spina bifida, which is a condition where the spinal cord does not form properly and the baby may have an opening in the lower part of the back where that's exposed, or there may be a very thin covering of skin over that which gradually forms quite a large swelling, and one of the procedures that we do is to try and repair that and control that swelling and protect that spinal cord.
My name is Rotarian Angela Semkotu. I am also the immediate past president of the Rotary Club of Kampala Muyenga Breeze. I joined Rotary about 3 years ago, and this signature project started with my previous president, and so because of my background as an operating room nurse, the club thought that I would be the better person to chair the committee, having known the dynamics of working in a hospital. We have so far worked on a total of 11 patients, 4 VP shunts. We placed 4 VP shunts. We've done a couple of brain tumors, and we also did a spinal biopsy and a spina bifida patient. The camp overall has been successful, although we have not done as many patients as we have previously done. We have done more brain tumors than what we did last year, but we hope that with bigger publicity next year, actually starting off immediately after this camp is complete, we hope that the PR committee will go all wide around the country to make sure that we sensitize people, but we also get those kids that have that condition so that we can treat them and give them a normal life like any other child.
For the time we've been running this project, we are lucky to have partners. One of our best partners is KOSU. KOSU is the hospital along Entebbe Road.
Zambia Hospital has also been very, very instrumental in this project. They've done our scans for the project, but also because Zambia has some bit of Rotary blood in themselves. There's a Rotary hospital, cancer ward already there. So we thought that we could partner more, especially for our project.
We're also partnering with Mulago Hospital and IHK. IHK is an international hospital, Kampala. And also we're partnering with Medilink, and we have signed a contract to partner with them for a long time, including KOSU Hospital.
So moving forward, we are continuing with these partners, definitely, and we're also looking for other partners because the project is still young, but it's looking to go bigger, and it has already grown bigger than what it was 2 years ago. There's a lot of work involved in running a neurosurgical camp like this. Most people see the face of it, but behind the curtains, there's a lot of running around and involving so many departments to be able to pull off a very successful camp that we actually did pull off, not just this year, but even the previous years. We thank the sponsors who come in because they are mindful that Rotary is serving humanity, and we are glad that these sponsors come in for us as we all endeavor to serve humanity.
My name is Patrobas Wafula Sirabo. I am the president of the Rotary Club of Kampala Muyenga Breeze for the year 2016 and 17. I'm a lawyer by profession, and I work with Equal Opportunities Commission, and that's what I do outside Rotary. But Rotary is where we find time to give back to the community, and as we define ourselves as a group of professionals who have identified problems in society, and we're looking for solutions to these problems. And so I invite you to join our club, join a Rotary club anywhere near you, because you'll be able to address issues that concern the community, whether you live in that community or associated with the community. Come and let's be impactful.